Pertussis, also known as whooping cough, is a serious respiratory infection. It's caused by a type of bacteria called Bordetella pertussis. These bacteria attach to the lining of the respiratory system, releasing toxins that irritate and inflame the airways. This leads to the characteristic coughing fits associated with the disease. Pertussis is highly contagious, spreading easily from person to person, especially before the coughing fits begin. Pertussis can affect people of all ages. However, it is most dangerous for babies, especially those under 6 months of age. Babies haven't yet developed a strong immune response. They are more vulnerable to the severe complications of pertussis. Pertussis typically progresses through 3 stages: catarrhal, paroxysmal, and convalescent. The catarrhal stage is the initial phase of pertussis. It often resembles a common cold with symptoms like a runny nose, sneezing, low-grade fever, and a mild cough. This stage usually lasts 1 to 2 weeks. The paroxysmal stage is marked by the onset of the characteristic whooping cough. The cough comes in forceful bursts or paroxysms. These coughing fits are often followed by a high-pitched whoop sound as the person tries to inhale. During these episodes, the face may turn red or purple, and vomiting or exhaustion may follow. This stage can persist for 2 to 6 weeks. The convalescent stage is the recovery phase. Coughing fits gradually become less frequent and less severe. However, it's important to note that complete recovery can take several weeks or even months. Pertussis spreads easily through respiratory droplets. When an infected person coughs or sneezes, tiny droplets containing the bacteria are released into the air. These droplets can travel up to 6 feet and infect others who inhale them. It's important to note that people are most contagious during the catarrhal stage when symptoms resemble a common cold. This makes it crucial to practice good hygiene, such as covering coughs and sneezes, and to stay home when sick to prevent spreading the infection. Pertussis can also be spread through close contact with an infected person, such as sharing eating utensils or touching contaminated surfaces. Maintaining good hand hygiene, such as frequent hand washing with soap and water or using alcohol-based hand sanitizers, is essential in breaking the chain of transmission. Complications and risks of whooping cough. While pertussis can cause discomfort and disruption in people of all ages, it poses the most significant risks to infants and young children. Their immune systems are still developing, making them more susceptible to severe complications. One of the most common and serious complications of pertussis in infants is pneumonia. Pneumonia is an infection of the lungs that can cause difficulty breathing, chest pain, and fever. It occurs when the Bordetella pertussis bacteria invade the lungs, leading to inflammation and fluid buildup. Another serious complication is seizures. These are caused by a lack of oxygen to the brain during intense coughing fits. Seizures can manifest as uncontrolled shaking or jerking movements and can be very frightening for both the child and caregivers. In severe cases, pertussis can lead to brain damage. This occurs when prolonged coughing fits deprive the brain of oxygen, resulting in permanent neurological damage. This can lead to long-term developmental delays, intellectual disabilities, and other neurological problems. Treating pertussis, antibiotics and supportive care. Treatment typically involves a combination of antibiotics and supportive care. Antibiotics are effective in killing the Bordetella pertussis bacteria. However, they are most effective when started early in the course of the infection, ideally during the catarrhal stage. Antibiotics may not completely eliminate the cough, but they can significantly reduce the severity and duration of the illness. Supportive care focuses on managing the symptoms of pertussis and providing relief. This may include ensuring adequate rest and hydration. Encourage the child to drink plenty of fluids to prevent dehydration from coughing and fever. Providing a cool mist humidifier can help soothe the airways and loosen mucus, making it easier to cough up. Offering smaller, more frequent meals can help, as large meals can trigger coughing fits. So offering smaller portions more frequently can be helpful. In severe cases, hospitalization may be necessary to provide respiratory support such as oxygen therapy or mechanical ventilation, and to monitor for complications. The power of prevention vaccination against pertussis. Vaccination is the most effective way to prevent pertussis and protect individuals and communities from its harmful effects. Vaccines work by introducing a weakened or inactive form of the Bordetella pertussis bacteria into the body, triggering an immune response without causing the disease. The DTaP vaccine protects against diphtheria, tetanus, and pertussis. It is given as a series of 5 doses in early childhood, typically at 2, 4, 6, and 15 to 18 months of age, and again between 4 and 6 years old. The DTaP vaccine is a booster shot that protects against tetanus, diphtheria, and pertussis. It is recommended for preteens around 11 to 12 years old and for adults with every pregnancy. Vaccines are not only safe but highly effective in preventing pertussis. However, like any vaccine, they may cause mild side effects such as pain, redness, or swelling at the injection site, low-grade fever, or fussiness. These side effects are usually mild and temporary and are much less severe than the potential complications of pertussis.